Hey. A very good afternoon to all of us today. Um, Dr. Hatcher, can you hear me? Unmute
Hello.
yourself and let's see.
Good afternoon, Dr. Atta. I hope you can hear me too.
Yes, I can hear you. Good, good, good. A warm afternoon to all of us. I hope you've all had a fruitful week. Today we are going to have another interesting topic as such. And lifestyle and sleep problems, its mental health implications, and remedy. Before I go on, let me remind us of the housekeeping rules. The moment you join us or in between the program, make sure that your microphone is off rather, so that you do not distract us. Feel free to send in your question and your comments, but we would open the line during the program for you to ask your question. And by so doing, you raise your hand and I'll ask you to make your submission. Again, we are going to discuss mental health. So when you get the opportunity to ask your questions or even in your comments, I plead with you to be as sensitive as possible because we are discussing mental health. MHA has a help line, a call center that we operate now. And for that matter, those who need psychological first aid can call in to get that help. And the line is 0800. It's a toll-free line, 0800 678 678. 0800 678 678. Yes, so today we are discussing an interesting and a very problematic issue that we all deal with, sleep. Who does not sleep? We all sleep, and we need a good amount of sleep. I'm pretty sure that considering the age limit within this platform, we all need not less than 6 to 8 hours of sleep. Our children even need more. Our children even need more. So when you get less than these hours, there is a problem. But the current situation that we find ourselves in, it's hard to get the number of hours. And sometimes our own lifestyle deprives us of getting the hours that we need. And this can be problematic because it has mental health implications. At the end of the program, when we understand the mental health implications of lack of sleep, we would understand and would know what we need to do for ourselves, our children, to make sure that they had good sleep, the good number of hours that they need to. So that is what we are going to discuss today. At the end of the day, we'll get to know the common lifestyle that gives us sleep problems, its impact on mental health, and homemade remedies, the little things that we can do to remedy the situation. So we'll get the ball rolling with this time the format is different. We'll let our facilitators do a presentation. As usual, those of you who are joining us for the first time, um, our program is recorded, and after we are done, we upload it onto YouTube. All our programs have been uploaded onto YouTube. So we just go onto YouTube, type in MHA Webinar, and you have all of them there. This current one will be uploaded hopefully on Monday. So exercise patience, if you need a recording of all the presentations, you get it on Monday. Our first presentation will be done by Dr. Julius Hatcher. He is a psychiatrist at the Pantan Hospital. He'll be telling us about the common lifestyle that causes sleep problems. So, Dr. Hatcher, over to you. Can you please do that in 20 minutes for us.
Thank you very much, Dr. Atta.
You can share your screen so that we can have a look at it.
Okay. Can you give me a sec? Please, can you see my screen now?
No, please.
That a triangle.
Okay.
That a triangle.
Zero one.
Triangle.
Yes.
Sarah or Sarah, kindly
Yes.
mute yourself. Sarah or Sarah, kindly mute yourself.
Please, can you see my screen?
Yes, please. Yes, we can see your screen now. Please go ahead.
Wonderful. Good afternoon to everyone. And I'm happy to join the webinar today, presenting on some of the common lifestyles and their effects on sleep in general. My name is Dr. Julius Hatche. I'm a psychiatrist responsible, as I have already been introduced. So I don't have a lot of time, so I'm starting immediately. And this is a picture that AI gave me on how sleep or lifestyle can affect our sleep. The various things in the picture depict some of the various things that we do as individuals that have a direct or indirect effect on our sleep, the quality of the sleep in itself, and how much we are able to enjoy it. We are going to talk about all the various aspects that probably you are seeing. You are seeing some laptop, or is it a tablet? You can see some books, probably a cup of coffee over there, and even a phone in hand. I don't know whether I can see rightly, but these are some of the things that we are going to talk about today. So this is just to juggle your minds as to what this presentation is going to be about. Now, the outline will take this form. We'll talk about sleep disturbance or disorders and versus what sleep health is all about. And then factors that affect sleep, factors affecting sleep in general. Then we'll also mention, we'll zoom into the meat of the presentation, which is the lifestyle that seem to have a direct or indirect effect on sleep. Then we conclude from there. Okay. So over the period, we've been speaking or talking about sleep in the light of sleep-related disorders, which means that it's either an individual is sleeping well or they have a sleep-related disorder. But it's been noticed over the years that leaves room for a lot of space and a lot of gaps in between for us to be addressing, because people may not necessarily have any sleep-related disorder, but they may not be enjoying the quality of sleep. So the vocabulary or the concept of sleep health has been emerging over the past decade, and it stimulates scientists and sleep physicians to look at sleep in a more holistic manner, so that nobody is left out of the continuum of the sleep spectrum. So the sleep health looks at things like how alert the individual is, how efficient their sleep is, how they feel satisfied whenever they sleep, things like duration of the sleep and how regular is the sleep, and even things like timing of the sleep. So if we talk about sleep health, you realize that all of us probably online at the moment are at one point of this sleep health spectrum or the other, and we may not necessarily have a particular sleep disorder. We may not have a diagnosis like a sleep disorder. Good. So we'll be using the term sleep disorders, sleep health in general when we are doing this presentation. So pardon me when you hear me say sleep health or sleep disorder. We are going to use them in tandem. Now, some of the factors that affect sleep have been outlined here. Aging is a very important factor that really has an effect on sleep. Generally, there's been a mixture of information with regard or evidence with regards to age and its effect on sleep. People say that when people are aging, they sleep much, much more than when they are younger. And others also say that, well, people who are older report more of sleep-related problems or sleep complaints compared to younger generations. So the evidence is almost not clear, but if you put everything together, you realize that symptoms related to sleep come a lot more from the adult population than the young population. Gender issues. Females are reported to have more frequent reportage on sleep-related issues than males. And so for females, I think it's about 1 in 4 of females who report about sleep issues, whilst men report about 1 in 5. Weight also has a direct effect, bringing to bear other conditions like sleep apnea, and even the level of relaxation that the individual experiences whenever they are asleep, or activity when they are asleep. So weight also plays an important role. And very importantly, are certain physical health conditions that elicit pain or physical illnesses. For instance, somebody with a heart failure having fluid or water in the chest, they will definitely not be able to lie down quietly or peacefully and breathe normally to be able to even enjoy their sleep. And obviously, mental health conditions also bring about a lot of sleep problems, like anxiety, even psychosis. Usually, some of the very early signs and symptoms that we may pick from individuals who are developing psychosis is the problem with regards to sleep. They complain there of an inability to sleep. Almost every mental health condition has a bearing on sleep, from depression to all the anxiety conditions, and you name it. Now, environmental factors like ventilation, aeration, lighting, the smell of the environment, the availability of mosquitoes, the number of windows, they all have an effect on the sleep that an individual may be having. Now, sleep health is also affected by psychosocial factors like some disturbed family dynamics, an individual going through a divorce whatsoever. They may have some challenges because of probably the anxiety or depression that it may be stimulating or bringing to bear in their lives. But our focus today for this presentation is the lifestyle issues that affect or have an effect or bearing on our sleep. Now, so we are going to talk about some of the common lifestyle issues or lifestyle situations that have an effect on our sleep. So the first thing we'll be talking about is nutrition. Nutrition in terms of malnutrition, overnutrition, and so on and so forth. Like exercise as well as media use, the usage of various media, televisions, social media, talking about whether maybe do you have a routine, do you have a schedule, or things happen spontaneously, and this schedule, is it being changed too regularly as you more than it has to be? Then things like having a pet. These days, a lot of homes, a lot of houses have dogs. Some of these dogs look very nice. They also have a bearing on how an individual is able to enjoy their sleep health. Then things like reading. You saw in the previous picture that was depicted that this individual had some books on his table beside his bed. He probably reads when he is on the bed. He has some tablets that was on the table close to him. And then we'll mention a few other things as well. So let's zoom in to talk about the individual aspects. So nutrition, for instance, nutrition when it's poor is known to have a direct effect on the duration of sleep that the individual gets in total. And so I'm sure in the local parlance, they call something like inkiting, whereby the individual sleeps and apparently they wake up in the middle of the night because they are probably excessively hungry. What people do not know, or most people are not aware of, is that you need energy to also be able to sleep. And once you are not getting adequate nutrition, definitely your sleep will end up being affected. Now, there's something we call sleep latency, which is to lie down in bed, put off their lights, and say, I want to sleep. This particular time, from that time that you put off your light, lie on the bed, till the time you actually fall asleep, is what we refer to as the sleep latency. Averagely, it's supposed to be between 6 minutes to like 30 minutes. And for people with poor nutrition, it's been noticed that sleep latency becomes longer and they might lie in bed for a very long time before they finally fall asleep. There's also a high frequency of reports regarding the sleep in general in people who are also obese, people who overeat, and for that matter, their BMI or their weights are too high. It's known to also have a direct effect on the amount of sleep that they may enjoy. Okay. Now let's go on to exercise. Exercise is one thing that, combined with a good sleep, leads to an improved mental health and improved physical health in general. But the quality of sleep itself is affected by the amount of exercise that an individual does. So people who are known to have a regular exercise routine are said to have reported lower symptoms related to sleep compared to people who are sedentary. So this is to say that sedentary lifestyle is something that really affects the sleep of people. So it's something that sometimes we even prescribe at the level of the clinic, that when people report difficulty falling asleep or sleep, especially in the elderly, we encourage that they should increase the amount of physical activity or exercising that they do. So moderate to vigorous exercises are reported to reduce the likelihood of having a sleep disorder. This time around, we are talking about a diagnosable disorder in itself, so that the more an individual, an adult or an adolescent, does physical activity to moderate levels or even vigorous physical activity, they are less likely to come up with a sleep disorder later in their lives. Okay. Now, the big topic, which is the media. The media, as we have it, can be divided into various groups, and the easiest or the simplest way is the traditional media and then the social media. The traditional media includes the television, the graphics, and so on and so forth. But here we are referring to the media in terms of the electronic appliances and devices. Watching TV itself has an effect on sleep. There is one thing about the media devices or these electronic devices that directly stimulates the brain, affects our circadian rhythm, as well as our hormones itself that are responsible for regulating sleep. And this is the what we call the blue light technology. Blue light technology is a feature that, or it's a kind of light that is emitted from these media that I have already mentioned. And we know that increased exposure to these media devices leads to a poor sleep, which means that the sleep duration that an individual may have is shortened. Dr. Social media or social rhythm is a very, very important thing we should be paying attention to as individuals. Then we'll talk about the pet ownership. This it sounds a little foreign to us, but like I mentioned, a lot of us have got dogs at home, and we use these dogs or these pets for various reasons, for security reasons and for companionship. It's been noticed that people or individuals who own pets are said to have a better sleep compared to people who do not have pets. And the aspect of sleep that is affected by the ownership of these pets and animals is the duration of sleep in general, as well as what we call the sleep latency. That's the period it takes an individual to fall asleep. Probably the pets are stimulating and providing companionship to allow the individual to deal with the anxiety and depression that they may probably be experiencing from loneliness at the end of the day. The last but one thing I also want to mention is reading habits. There are some of us who like to read, especially when we are going to bed. Either you want to read the Bible or the news or what have you. Research has demonstrated that once you read, you read and you are doing this kind of activity on your bed or in your bed space, it has a direct effect on your sleep in general. However, when you are comparing reading from a printed text to reading from a media or a device, reading from a printed text has got beneficial results compared to reading from a media, most likely because of the same blue light technology that the media devices have, which has an effect on changing the circadian rhythm, and for that matter, prolonging the time that it takes for you to fall asleep, as well as the duration that you may remain in bed. So if you have to even read whilst you are in bed, which we do not encourage for that matter, it will be better for you to read printed text at the end of the day. Now, the last things and a few things that I want to talk about before I end my session is other behaviors like personal hygiene, other lifestyle behavior. There are some who do not have the habit of maintaining their personal hygiene regularly. It feels better and makes people fall asleep quicker when they are refreshed and going to bed. And so once they have their bath, they sleep better and have an undisturbed sleep. Then other screen addictions like gambling, pornography, and let me add internet fraud also to it. Most of the gentlemen who are, or the youth who are engaged in internet fraud, they complain, and at the clinic we've received multiple complaints of that sort that has to do with their sleep. And sometimes they resort to using even certain stimulants like coffee and things to stay awake, because they want to be able to, as they call it, to chat their clients online, especially in the night. and that has a direct effect on their ability to fall asleep at night, and for that matter, stay awake in the daytime. Then there is this use of airtime at night. Some of these telcos make certain offers whereby they give people free credit, free data to use, especially at midnight. And so we get the youth or most people staying awake, waiting for those periods for them to be able to use the internet or the airtime that is available to them. And that in itself, as a lifestyle, has an effect on the individual's ability to sleep. I must say that these are not an exhaustive list of the things that affect our sleep in terms of our lifestyle. However, it's important that these ones have become very topical in recent times, and that is the reason why we are capturing them in this particular presentation for the time limit that we have. So in conclusion, sleep is an essential component of our health and well-being, and it goes beyond just the ability or an individual having a sleep disorder in itself. And the sleep health that we expect to have is affected by so many things, but some of them we do not have any control over. But the things that have to do with our lifestyle, they are still within our means, and we can do something to curtail them. So I will end my presentation here with a thank you note and allow the other presenters to take on. Thank you very much.
Well, thank you very much, Dr. Julius Hatcher, for that wonderful presentation. Really appreciate it. I mean, at this point, we know that it's not only our lifestyle that affects our sleep. Other factors also impinge on how many hours that we get of sleep. Age, gender, weight, nutrition, exercises, our reading habits, and all that contribute to our sleep patterns. We are way out of time, so I would not talk much. I would invite our next presenter. She is a physician, a clinical psychologist, a physician as well as a clinical psychologist, and she is the head of therapy and wellness department at the 37 Military Hospital. She is in the person of Dr. Erica Danfrikwa Dixon. Ladies and gentlemen, I present to you Dr. Erica Danfrikwa Dixon. She is going to present on mental health implications of sleep. Dr. Dixon, you have the floor.
Thank you very much. Good afternoon to you all. And thanks again for inviting me to come and share my thoughts. It's obvious that we've eaten into our time, so I'll jump right in. Following from what Dr. Hatcher presented, we know that sleep is very important. And for each of us, it should occupy at least a third of our day. But living in our country, especially in Accra, where there's so much traffic, sometimes you probably spend half of the time you should be sleeping, even in traffic. And so it's recommended that we each have about 7 to 9 hours of sleep. It's very essential for our very survival. It's as important as our food or nutrition and the water that we take. So it's a basic need. And Dr. Hatcher mentioned the quality of sleep matters and the quantity of sleep also matters. And all of these have an impact on our mental health. When it's good quality and good quantity, we have better mental well-being. And so sleep deprivation is a big concern. And it affects not only our our mental health, it actually causes some physical health problems, which is not particularly the focus of today's discussion. But some people would ask how long it takes, how long one person can go without sleep. Some studies have indicated that beyond 10 days of no sleep, you could possibly die. And sleep is a good indicator of our mental well-being. When you're sleeping well, most likely your mental health is also doing great. And this is why this topic has become essential. I know that my colleague has talked about the lifestyle issues, and so I won't belabor it. Now, how do we link this to mental health? I would like to expand a bit on this, that mental health concerns our emotions, how we're feeling, our cognition or our thought processes, how we think, and then our behaviors in actions and interactions with other people and with the milieu within which we are. And therefore, when we say that mental health, sleep affects mental health, these are the areas that we'll be looking at. Our mental well-being is what makes us function, our day-to-day, how we meet our challenges, the choices we make, our decision-making, how we interact with people. And so if sleep is going to impact negatively, these are the areas that it would impact. We all sleep, and sometimes it's assumed that we know what it is, but I took time to try to define it a bit. That natural, easily reversible period where you are unconscious to your environment. However, you are easily rousable. Somebody touches you, somebody makes noise, you wake up, you are not in a coma. And this period in our life, this a third period that we are supposed to spend daily, is very essential in restoring us. After all the hassles of the day, we need that restoration. Our body needs to revitalize and recover, and our mental functions as well need to recover. Even machines take a rest, and so our brain needs to take a rest. And it is during that period that the brain pathways does the cleanup job. Basically, it does the Zoom lion work. It creates new memories. There's all sort of communication that goes on in the brain during that period. And even toxins that have built up during wakefulness is gotten rid of. During that period of sleep also, we release hormones, insulin, growth hormones, and so on. These help regulate our body, our physical well-being. And one of the things it regulates is our stress level and our mood, which concerns mental health. Dr. Hatcher has mentioned some of the factors that will cause one not to sleep well. And so I won't delve too much into it, but they could be a lot of different things. And so when you find that you are not sleeping, it's important to seek appropriate help to be able to delve in. What is its impact when you are sleep deprived? Some studies have shown that within 24 hours of not sleeping, you are so drowsy, you are irritable, even your decision-making gets impaired, and your judgment is poor. Your perceptions may be altered, your memory, there are all kinds of deficits. How well you are hearing or seeing things even gets impaired, and your hand-eye coordination is also dented. And your whole muscles, all the muscles feel very tense. Some people will begin to have tremors. And because of all of these changes that happen, you are bound to make more mistakes, have accidents. It's been shown that not having good sleep, even for 24 hours, is almost equivalent to having blood alcohol concentration, which is above legal limits for driving. So it's as if you are drunk when you haven't had adequate sleep. These symptoms get worse And you would find that sometimes when you have gone 2 days without sleeping, you just can't keep your eyes open. What we call micro sleep. So you voluntarily fall asleep. So if you can imagine people who drive long distance and they are not sleeping, they may fall asleep whilst driving and cause all sorts of panic on our streets. Our immune system is disrupted when sleep is not happening. Our speech becomes very impaired. Now, our cognition gets really, really poor when we are not sleeping. And the longer the duration of lack of sleep, the worse the problem. Indeed, 2 hours of lack of sleep, you may even begin to exhibit some psychotic symptoms. Hallucinations, you become delusional, you may even become paranoid. And so sleep deprivation definitely has an impact on mental health. If we look at all these symptoms that we have talked about, and considering mental health, I have chosen to talk about each of the aspects of it. So first of all, our feelings or our mood. And there are people who have gone for all night or for some reason have not slept at night, and during the day, if they are expected to function, you can clearly tell they become grumpy, they are irritable, and sometimes downright angry at next to nothing. Nothing big has happened and they're upset. They feel frustrated, their mood is low, sometimes sadness, they are not easily excited, and they may have depression and anxiety because they haven't had good sleep. What about cognitive abilities? These are also very disrupted. A person who hasn't had good sleep is not able to remain alert. Their concentration and attention is poor. Their judgment and decision making, and they can be very illogical. They may be downright confused, and trying to recall things gets difficult because their memory is impaired. It can affect your work. It can affect your ability to learn or study. And so for our students who decide that they want to learn all through the night, as was the plan, then we must move. And so you stay up all night drinking coffee, putting your foot in water, and then you think you're learning, but you may not be absorbing much. And it shows in your exam results. Your reaction time is slowed down. And so where you have to operate any machines, it is a concern. Your problem-solving skills are badly affected. In terms of behaviors or actions, poor sleep or sleep deprivation leaves people unable to cope with just the normal day-to-day stresses of life. Some people may become suicidal, and they may engage in risky behaviors. I mean, one obvious one is that if you are feeling sleepy, if you are getting micro sleeps, and you won't pack off the street to sleep and get refreshed to move on, that's a very risky behavior. You put yourself and other people at risk. And because you are irritable, your interpersonal interaction with other people also doesn't go well at all. Now, mental disorders often would affect sleep as well. So Dr. Hatcher mentioned that psychosis, but the depressive disorders also, a significant symptom of depressive disorders is the poor sleep. And so for some people who have an atypical depression, they may do nothing but sleep. In bipolar disorder, this is also a symptom. And then anxiety, when people feel so anxious that sleep leaves them. Trauma and stress-related problems. So it may range from something has happened acutely or something that has been going on for a long time where adjustment is a problem, or significant traumatic experiences leaving a person with post-traumatic stress disorder. This would also interrupt with the person's ability to sleep. Schizophrenia and other psychosis, sleep deprivation may be a symptom. And then for those who use substances, alcohol especially can leave people's sleep disrupted. And so from what I've said, it is obvious that when it comes to mental health, the implications are great. A person not sleeping may not be sleeping because they're having a symptom of a mental disorder. But when, whatever the reason may be, whether it is social media, whether it is gadgets, blue lights, and so on, it can push the person to develop mental health symptoms. And sometimes they can be so significant, it causes disorders. To prevent some of these, and I believe that my colleague coming after me may speak to most of this, trying to have a sleep routine, even over the weekend, is helpful. It keeps your circadian rhythm on point. Doctor talked about exercising and then also mentioned the artificial lights. So lying in bed and using your phone and watching TV is not particularly healthy. He also mentioned the issue of meals, bedtime meals, heavy food. You are so uncomfortable, you are not able to sleep. And so it's best that we avoid doing these. Smoking, cigarettes, drinking coffee is not helpful. When we spend a lot more time outside, the activity level, the sun enhances our ability to sleep. And then the bedroom atmosphere, keeping it quiet, keeping it cool, keeping it dark or dim is helpful for sleep, because then you cut out the lights and the brain is able to register it's time to sleep. And then Doc talked about the personal hygiene, taking a hot bath before going to bed, or sometimes when the weather is too hot, then you need a cold shower to be able to feel more relaxed and sleep better. And so I hope that by this, we have gotten a little insight on how mental health impacts on our sleep and how our sleep also impacts on our mental health. Thank you very much. Dr.
Thank you very much.
Able to save us some time.
Yes, indeed, you have. Can you hear me?
Yes, I can hear you clearly.
Yes, thank you very much. Indeed, you'll be able to save us some time. You have. I mean, at this point, if anybody who has listened to your presentation would come to the conclusion that deprivation of sleep is there. Deprivation of sleep is there. I'm having internet issues, so I'm using my phone, so no camera, no nothing.
Yeah.
So I would also not waste time because we are about 33 minutes into this. I would invite our next speaker to do justice. She is going to talk about homemade and lifestyle remedy to avoid or deal with sleep problems. The little things, the basic things that we ignore. And she is going to talk about it. This person holds a Master of Philosophy in Clinical Health Psychology from University of Cape Coast. She's the president of International Women Empowerment Prayer Network. Also holds a degree in Health System Management from Institute of Galilee, Israel. A trained health minister from Akers Academy Currently, she's a nurse manager and a practicing clinical health psychologist at the Ghana Port and Harbour Authority Hospital in Takoradi. She's been in active service for the past 33 years. Ladies and gentlemen, I present to you Reverend Mrs. Angela Ojiri Asare, a clinical health psychologist. She is presenting on the topic, homemade remedy to avoid or deal with sleep problems. Rev, you meet my wonderful participants, and I've seen you are already sharing your screen. Please go ahead.
Thank you. Thank you so much, Dr. Tata. I really appreciate this opportunity. Please, can you, Dixon, they have almost presented my topic, so I'll summarize it because of time. And as we all know, we have homemade and lifestyle remedy to avoid or deal with sleep problems. And, you know, it's something that we know. So we are just going to, mention them one after the other. And then maybe after that, we can also add more to it. So I would say that, dealing with sleep problems actually can often be addressed through lifestyle changes and home remedies. Yeah, and there are some few approaches that we need to avoid or we need to manage to help us not into those complications. So I want us to know that, first of all, we need to know that we have to keep a routine. We need to keep a routine. We need to make sure that we establish a consistent sleep routine. Some of us, we sleep maybe late or early, but if we want to, help ourselves to have good sleep or good rest, we need to go to bed and wake up at the same time every day, even on weekends. And this will help to regulate our internal clock and improve, our
second year.
Our sleep.
Thank you.
So we also need to, engage in the calming activities before bed, like reading, meditation, and also, as our doctor said, we can have a warm bath, and these signals our bodies. And it tells us that it's time to wind down. Also, we need to optimize our sleep environment. We need to keep our bedroom cool, dark, and free from noise. Also, we can consider blackout curtains, or maybe, if necessary, we can also use eye masks or maybe ear plugs, if necessary. That can also, help us to induce sleep. Also, we need a comfortable mattress and pillows. You know, I remember those days we have a pillow called Sorry Juma. And you know, it's so hard and you can't even be comfortable. But now, thank God for good pillows. So we need to ensure that our bed and our pillows are comfortable to disrupt sleep problem. Also, we need to minimize exposure to screens. That's what Dr. Dixon mentioned. Our phones, our TVs. Some of us, we have our TVs in our bedrooms, and I think we need to try and keep them outside our bedroom so that it can help us to have a good sleep. We also need to, adjust to our dietary adjustments. But we need to avoid heavy meals before bed. You know, some of us, we eat late and we eat heavy, and then we go to bed straight after that. Large, rich meal can cause discomfort and indigestion, which may interfere with our sleep. So we should have to try to finish our meals maybe around 2 to 3 hours before bedtime, and that will help us to, sleep well. And also we need to pay attention to our food, like spicy food and sugary food. As I said, it can also, have a negative effect on our sleep. And those of us who drink, we need to also make sure that, we avoid alcohol and other drinks that stimulate our system. And if you want to drink, especially, you can take it 4 to 8 hours before bed so that it will not disturb your sleep. Also, we need to limit caffeine and nicotine. These substances, we all know that it's a stimulant and can disrupt our sleep. So we need to help ourselves and we need to avoid them if necessary. Also, we need to, expose ourselves during the day to sunlight. Exposure to sunlight help regulate our body sleep-wake cycle. And when we try to spend time outside in natural light during the day, so that in the night, our body sleep-wake cycle, can respond to us. Also, we need to make sure that, we use our bedroom for only sleep and sexual activity. Some of us, we do everything in our bedroom. We study everything in our bedroom, and that can also, distract our sleep. Let's try to use our bedrooms as, our sexual activities and only where we go to sleep. Also, we need to limit naps. We need to limit naps. When we take a long nap, if you need a nap, try to keep it brief and avoid napping late in the day, as long as naps can interfere with nighttime sleep. Also, we need to try and, do physical activities. Dr. Dixon mentioned it. Regular physical activity improves sleep quality. So during the day, at least, we need to try and do physical activities so that in the night we can, help ourselves to sleep. Also, we need to, gentle stretching before bedtime can also help relax the body, the mind, and then also, help us to sleep. We also have to look at our hydration. We need to take enough water or fluid during the daytime and, stay away from too much water before bed. Some of us, we drink just before bed, and that can also disturb our sleep. So let's stay hydrated, during the day, and then during the night, we make sure that we avoid, taking too much water to avoid waking up for bathroom trips. Also, we need to, according to research, these essential oils also help us. It also promotes sleep. It also calms the body, like lavender oil, chamomile oil, and there are a lot of essential oils that also, when we use, it also helps to induce sleep. And I think I'll testify about some of these essential oil. When you apply it, under your feet when you are going to sleep, it's soothing and it helps us to, to sleep well. Or maybe you can add a drop to, a diffuser, or maybe put it in a pillow, and it also helps us to sleep. I want to say that we can also, as a psychologist or clinical health psychologist, I believe that cognitive behavioral therapy, it's also one of the natural approach that can also help us, calm ourselves, calm our thoughts and our behaviors when, we are going through all this stress and anxiety. So we also need to manage our stress and our anxiety very, very well by also adding mindfulness and meditations and other psychotherapies also will help us to have our sleep. And we need to talk about our fears and worries during the day. We need to express, we need to tell people, we need to go and see the psychologists or counselors for counseling so that we can be able to have sound mind. Some of us, we keep things to ourselves and we go to bed with it, and that can also, hinder or cause sleep issues or sleep problems. So we need to, talk about our fears or our worries. We have to go to the right place so that, we can be helped. And also, we need to know that we have some natural remedies and supplement that when I went online, I realized that it also helps. Magnesium supplements and melatonin supplements, they also help to induce sleep. So we need to try and, if we, are having sleep problems, we can also, look at that. And also look at that. And also we need to, try and write our thoughts or our to-do list before we go to bed. So that, and this thing, it helps because it's reduce, it's help us to, to calm down during the day, during the night. So if you are if you have any problem, if you have anything, just write it down. Have any program, just put it down, journal it. And then later after sleep or after you wake up, you can be able to look at it. It helps. Or if you want to, do something, we write our to-do list a day before in the night so that you don't, it will not be in your mind, in your thoughts. Also, sorry, I've mentioned this. Okay, so in conclusion, I want us to know that we have a lot of remedies for sleep. We have a lot of remedies for sleep. So one thing I believe is that it's God who gives us sleep. So we need to remember that we need to pray before we sleep. Prayers help us and calms us down when we go to bed. Because as we all know, the Bible said that in peace, I will lie down and sleep. For you alone, Lord, make me dwell in safety. So I know there are other remedies that, we can add to it. These are few ones that are, important for us. Thank you.
Thank you so much for your presentation. You have given us a lot of homemade remedies, little simple things that we can do. My dear participants, it's time for question and your comments. Feel free to share in your comments. And as you can see, I've shared a link with you. We are taking an evaluation. Kindly, please respond to it for us. It will not take you more than 2 minutes to do that. Just click on it and fill it as you've usually done. Please, if you have any question, show by hand. I'll call you and ask you to unmute. Then we can move on. Okay, Gilbert. Gilbert has a hand up. Gilbert, unmute yourself and let's hear you.
Yes. Thank you so much for your presentations. I have a few questions for all the presenters. The first question is for how.
Gilbert, is that you?
No, I'm not the one.
Who is speaking, please?
The background, I'm not the one.
Okay.
This Gilbert talking,
so
but
Gilbert,
the background noise wasn't. I wasn't the one.
Okay, that's
Yes.
fine. Okay, so Gilbert.
Yeah, sorry for the interruption. I'm saying that I have some few questions for all the presenters, and then kudos to their wonderful presentations. The first question goes to Dr. Hatcher. Yeah, so he mentioned a point that about pet ownership or pet owners, and then if you have a pet, it has like in terms of longevity of your sleep is short, is longer. But someone who doesn't have a pet, I think the person have a shorter sleep. And I don't know how maybe it might be able to apply to a foreign country, but I don't know how this particular point apply to something like Africa. Or maybe if you can explain better. But I know for sure, physically, if you have a pet, something like a dog, which African will keep as a form of security, it barks almost throughout the night, and it might disturb our sleep compared to someone who doesn't have a dog or a pet. So maybe if you can explain further for me to understand. And then so to Dr. Hatcher, in terms of the factors, I want to know whether socioeconomic status has an effect on sleep. For instance, if you are comparing a poor person and a rich person, which of them has a better quality of sleep? Yes. So now the next presenter, that's Dr. Dixon. He mentioned about sleep deprivation, which is having
Gilbert,
a lot of.
Gilbert, hold your fire. Hold your fire. You see, there are a lot of hands. So you've asked 2 questions. Let's do this round, then we'll come back.
Okay. Thank you.
So you asked 2 questions. Dr. Hatcher. Madam Florence, please mute. Okay. So, Dr. Hatcher, Gilbert is asking about the dogs. In Africa here, they make noise, so they disturb your sleep. Elsewhere, they are quiet. How do you explain that analogy? Then his next question was about a poor man and a rich man who gets a good sleep. And what is the scientific basis behind that one?
Okay, thank you very much, Gilbert. Those are very interesting questions and I think very practical as well. Yeah, so this particular research that found the benefit with regards to having pets was not conducted in our setting. However, a qualitative aspect of the finding is that it was people who own the pets have a certain sense of security. And that sense of security is what gives them that peace of mind to be able to sleep. That is one aspect of the study. Then the other aspect of it also was that some of them kind of cuddle these pets. So some of them even lie in bed with the pets. And although we are thinking that it only applies to the foreign setting, in Ghana, I've seen a lot of people sleeping on their beds with their dogs. I've visited people and the dog is sitting in the chair in the hall. And it's like the dog is a family member. So we may think that it is too far away from us, but it is coming home. It's coming here. You understand? And honestly speaking, I think that if it's something beneficial, then why don't we use it also to our advantage at the end of the day? All right. With regards to the second question, which where socioeconomic status of an individual might have an effect on sleep health. Yes, it is true. There is evidence, there is finding in literature that people who are living in high-income countries are said to have better sleep health compared to those who are living in low socioeconomic area or low middle income countries. And in fact, the employment status of the individual also seems to give them a certain level of peace of mind to be able to sleep well and also have a longer duration of sleep. The issue here is there is a correlation, and especially when it comes to nutrition. You realize that poor nutrition correlates with the level of socioeconomic status for most people, apart from the issues of obesity and the rest. But usually, poor nutrition is something that is found among people who are of the low middle income countries. So you may see kwashiorkor and things in sub-Saharan Africa and some parts of Asia. It's hardly will you find that in the Western countries. And these have been correlated to imply or to inform some of these reasons why it's said that low socioeconomic status is countermand to having a poorer amount of sleep at the end of the day. Thank you. I hope that answers your question, Gilbert.
Yes, thank you so much.
Whilst Dr. Arthur is finding himself to come back on, let me also add on to the pet issue. Even though we keep them for security, sometimes just the knowledge that you have these dogs around to keep you secure, to alert you if anybody was intruding, leaves people sleeping better. You sleep easy knowing that you have some security. Thank you.
Yes,
thank you very much.
But I was looking at the noise. You know, the back when somebody is coming in the night. So the noise alone can wake somebody up.
Sure.
That was also the aspect I'm looking at that from.
Yeah.
Thank you.
Thank you.
Thank you. All right. Please unmute yourself and make your submission.
Okay. Good afternoon.
Good afternoon.
Good afternoon to my name, Dr. Dixon.
Yes.
I would like to ask Dr. Acha a question. I heard him mention, so I was a little bit confused. I wanted him to explain a little bit further on it.
Thank you.
Overnutrition.
All right, that's fine. Dr. Ache.
Yes, Dr. Arthur, thank you so much. Again, Mr. Dixon Aponsa. Yes, so overnutrition and nutrition is a problem when it comes to sleep. And then overnutrition is also a problem when it comes to sleep. Now, with regards to overnutrition, I mentioned that once you are overnourished and you get obese, obesity comes with so many other problems. Prominent among them is a thing like sleep apnea, which actually is the cessation of your breath, temporary or periodic cessation of your breath whilst you are asleep. And that decreases the quality of the sleep that you may have. You may wake up feeling unrefreshed and that therefore experience things like daytime somnolence. Time will not permit us, but otherwise I would have mentioned into details how some of these things okay. However, even when you overeat in the evening, you eat meals, heavy meals, rich meals, and especially oily meals, you realize that the food will end up not being digested before you actually fall asleep. And that can cause things like regurgitation and disturb the sleep even in the night. So undernutrition is a problem, but overnutrition is equally a problem as well. Thank you.
Thank you very much. I guess that's your question have been answered. Would you be kind enough to lower your hand for us? Our dear participants, we need you to fill the forms for us. That guides us into what we are doing. We have received very few responses. Would you be kind enough to respond to us respond to it for us? It takes just a few minutes. Okay, so Patrick Martin, please lower your hand and let's hear you. Patrick.
Yeah, thank you so much. I'm grateful for the opportunity. I've learned a great deal from today's presentation. I want to find out there are some studies that have shown that sleep deprivation has some.
Your network is quite bad. I don't know whether it's mine, but I can hardly hear you. I don't know if my facilitators can hear you.
Yes,
please go ahead.
I could hear him.
Yeah. So my question is that there's some studies that have shown that deprivation has some antidepressant effects. I want to know their views on that and how someone can strike a balance if the person is trying to use that to take care of his or her depression. Thank you.
Okay. I would give it a shot. Personally, the studies that I have looked at that use sleep deprivation to manage depression are pretty much experimental. The feasibility of it is a little challenging. It's not as pragmatic because, well, naturally, people who have depression, most are unable to sleep, and you would have to be awake for some that I read, quite a number of hours. But also that effect is very short-lived. When you fall asleep and wake up, the seeming beneficial effect you had on it lifting your mood is gone. And so I believe that probably more studies would have to be done to see how that can be harnessed. I hope that answers you, Patrick.
Dixon, I don't know if it's right for me to also add a little bit to that. So I agree with Dr. Dixon because some experiments have been done as to how keeping someone awake for a longer period of time can help to improve their mood and their level of activity. But even if you examine the evidence, it's more of, should I call it anecdotal? Or even, let me say, it's more of agitation. So the fact that somebody's level of activity has increased doesn't necessarily mean that their mood has improved. That is one. I think primarily informed by the idea that for certain types of depression, like seasonal affective disorder, we expose them to a certain amount of light in a day. And at the end of the day, it improves their mood. And so that's what informed that thing experimentally. But I think it's still in the very early days. And what we know clinically is that people who are rather depressed often are unable to sleep. And once they get good amount of sleep, they actually report feeling better, much better. In fact, there are some of them that after the kind of treatment you want to give them, they say, oh, just give me something to be able to sleep. And I know when I sleep, I'll feel better. And it works quite well for a number of people as well.
Thank you very much, Patrick, for your submission. I think that solves the issue about sleep deprivation and as an antidepressant. Well, more research and science would have to give us a clear picture, but at this point, it doesn't seem to be clear which direction it's going, but we'll see. Charles.
Yes.
Please lower
yes. Hello.
And yes, Charles.
Yes, I quite enjoy the topic that has been treated today. To actually say the truth, I have an issue with sleep for some time now, about a month or two. I am able to sleep only 3 hours and will be on the bed throughout the night. But the unfortunate thing is that I missed the presentation of the previous speakers. I only met the last person. And I'll be grateful if there's a way I could get their materials to be able to read and then, help myself, because I'm having that challenge.
All right, Charles, thank you for your submission. If you join us late, but what we normally do is that we record this program and we upload it onto YouTube. So hopefully by Monday, you can find it on YouTube. Just type in MHA, the letters MHA, and add the word webinar, including the topic for today's discussion. It will pop up. All others that we have done in the past will also pop up, so you can get access to what we've done today. I would also say that you can really chat with Dr. Deskin. She is a very busy woman, and see if she can offer some help to you. As any of them, you can chat with any of them privately and see if they can give you some help on the side, because obviously you might need that. Anthony, hold on, Anthony. Let me read a question here. I think that let me read a few comments. Patrick, Patrick from Bangkok, she says, my struggle has always been with a fear of death, which made me to sleep. Despite taking my medication, I can go up to 3 hours being able to sleep. Sleep deprivation does. I don't know whether you are seeing a professional or not, but Dr. Destin, can you respond to Banfua for me?
All right, Banfua, we raised some of these issues. Having anxiety over any issue, any concerns, and in your case, the fear that you would die, tells me that you may be having some form of an anxiety disorder causing you not to sleep. And so, just as Dr. Arthur said, I would encourage that report to a practitioner so that you are properly assessed and the necessary management given. It may not even have to be taking medication. Some psychotherapy could be very useful to bring about a shift for you. So that's the charge I give you. Please report to any health facilities. These days, almost all health facilities have mental health units. And so depending on where you live, you go to the closest place and seek that kind of help. Thank you.
Thank you, Dr. Dixon. Yes, Banfua, get to any close health facility, ask for the mental health unit. You see, the problem with mental health or mental health problems is that it does not get better when you sit and wait, hoping that it will get better. You need to take some action for it to remedy. And the earlier you take the action, the better. So I would implore you very, very much to take that step now, to go to the nearest health facility, ask for the mental health unit, and talk to them. They will definitely be of immense benefit to you. A few of you have asked me, where is the link? Where is the link? Please, I have reposted it several times, and let me repost it again now so that you could fill it for us. We need your responses, please. Michael, please lower your hand and make your submission.
Good afternoon, and thank you for such a wonderful presentation. I have learned a lot. But you mentioned Ray.
Thank you. I was saying that in actual fact, we have about 33